Now, how to study the connective tissue? For example, first of all, you must know what is connective tissue, right? Mainly the definition of the connective tissue. After that, the structure of connective tissue. That means the components of the connective tissue. How many components are there? 3 components are there. For connective tissue, I have given a shortcut. Connective tissue, first alphabet क्या है? C. कितना number है? 3. Most of the things related to connective tissue are 3 only. ठीक है? This is the way to remember things. Easy होता है. Okay, but once the components are done, next is the classification. Okay, based on what the classification is done. So today first we'll revise what I have explained that day. So it will be revision followed by the classification. Okay, and then I am having some slides of connective tissue. I will show you the slides of connective tissue. Same like the epithelial tissue. Okay, which we have covered. So by definition, connective tissue is a tissue that binds, separates, okay, which will bind, which will separate all other tissues of the body. Along with that, it will fill the interstices between the more specialized element to bind them and to support them together. ठीक है, इसका मतलब क्या है? Suppose 2 different types of tissues are there. ठीक है, 2 different types of tissues are there. Now this connective tissue, what it will do, either it will bind these 2 tissues, or what it will do, it will separate the 2 tissues. Along with that, it will fill the interstices. Suppose यहाँ पे एक tissue है, यहाँ पे एक tissue है, और suppose यहाँ पे एक organ है, यहाँ पे एक organ है. In between them, the space which is there, that will be occupied by the connective tissue. Okay, why? To provide support to both the tissues. Along with that, to hold them together. So this is the connective tissue. Okay. Now, in case of connective tissue, the speciality is the cells which are present in the connective tissue, they are widely separated. In epithelial tissue, what you have seen, how the cells are placed very close to each other. Okay. But in case of connective tissue, cells are present, but they are widely separated from each other. Next, in connective tissue, all the cells are not having similar structure and function. In epithelial tissue, if it is cuboidal or cuboidal cell, if it is columnar or columnar. But in case of connective tissue, all the cells are not same. Different types of cells are there. Okay. Next, in case of connective tissue, another extra thing which we are getting, that is the fibers. Okay, 3 different types of fibers are there. Okay. Now, if you see the component, so what is connective tissue? I hope it is clear. Next, if you see the components of the connective tissue, if you see the components of the connective tissue, 3 components are there: cell, fiber and ground substance. These are the 3 components of the connective tissue. Okay. So what are the different types of cells present, that you have to know? What are the different types of fibers? And the ground substance, it is made up of what? What are the different biochemicals are present in the ground substance? How it is formed? What is the function that you have to do? Now here is a classification. You can use this classification in your practical notebook. So same like the epithelial tissue, you have to write in your histo notebook about the connective tissue also. Okay. Now for that, the previous batch, when they came yesterday, I have mentioned what you have to write, what you don't have to write, which diagram you have to draw. Okay. So they have highlighted all those things. I will request everyone to ask them and get it done. After that also, if you are having any problem, you can ask. So here you can see the classification of the different types of components. Cells, 2 different types of cells are there. Okay, what is the meaning of that? Resident cells and wandering cells. Resident cell means permanent cells, permanent resident. Okay, wandering cell means, yes, the refugees. okay, came from outside and then become the member. Okay, so this is the venturing cells. Next, in the fibers, how many types of fibers are there? 3. See again 3. ठीक है, so ऐसे ही याद करना है. So 3 types of fibers are there: collagen fibers, elastic fibers, and reticular fibers. ठीक है. Next, what is the component? Ground substance. Okay, you can see the ground substance. Intracellular ground substance. It is made up of proteoglycans, glycoproteins, and glycosaminoglycans. See again 3. Okay, so that's why in the beginning I mentioned most of the things related to connective tissue are 3. Now let me show you a diagram. So this is the ideal diagram to show the connective tissue. ठीक है, because in the beginning I have mentioned that जो connective tissue है उसमें 3 components रहता है, 3 components रहते हैं. ठीक है. Now in this diagram you can see all the 3 components. Okay. For example, can you see the cells? How the cells are arranged? It is widely separated, okay, distributed in the ground substance, widely separated from each other. Next, if you see the cell, all the cells doesn't look same. The shape of the cells are different, right? Next, can you see the fibers? देखो fibers दिखाई दे रहा है. ये देखो, these are the fibers. These are the fibers. Okay, different types of fibers are there. Now, all these components are held together by a gelatinous ground substance, you can say, that is the gelatinous substance that is called as extracellular matrix or ground substance. Okay, that also can be seen. Next, this is the list where different types of cells can be seen in the connective tissue. So 2 different types of cells are there. Okay, fixed cells and free cell are also called as venturing cell. Some books it is written as free cells, in some books it is written as venturing cell, meaning same way. Okay. Now in the fixed cells, what are the different types of cells present? Let me show you the diagram. Here you can see the diagram. Now in this diagram you can see fibroblast, fibrocyte, then adipocyte, macrophages, neutrophil. Okay, different types of cells are there which can be seen over here. Okay, and this diagram you have to draw, very important. Why it is important? Because here it is shown in H&E stain. Okay, that means under hypermagnification in H&E stain you can see the cells like this. Okay, so which is the most abundant cell present in connective tissue? Which is the most abundant cell present in the connective tissue? That is the fibroblast. Fibroblast is the most abundant cells present in the connective tissue. Now, can anyone tell me what will be the function of the fibroblast? First of all, if you see the fibroblast, it is elongated, spindle shape. And under microscope, stellate appearance is there. That means star-like appearance is there. Okay. Production of the fibers, different types of fibers. Next, laying down of the matrix. All these are done by the fibroblast. Okay. That's why fibroblasts are very important cell and most abundant type of cell in the connective tissue. Now after fibroblast, fibrocytes are also there, as you can see. So these are immature cells, small, very thin, and functions are also different than the fibroblast. Okay, next you can see the macrophages also. Macrophages in the connective tissue are also called as histocytes. Okay, macrophage का function already you know. It is, what is the function of macrophages? Phagocytic activity. Okay, that is the function. Next, mast cells are also there, are also called as histaminocytes. These cells are also present in connective tissue. Okay, they are the precursor of histamine. Okay, the histamine which causes allergic reactions in your body. And whenever you are taking any anti-allergic, these are nothing but antihistaminic, which will go and inhibit the mast cell to produce histamine. Okay. Fat cells are also there. As you can see, these are the fat cells. So I am having one slide where I will show you the fat cells today, also called as adipocytes. ठीक है, इसका फंक्शन क्या है? Store fat droplet. Because of the storage of the fat droplet, the cell organelles are pushed towards the periphery. That's why you can see the position of the nucleus. Just see the position of the nucleus. It is at the periphery. Next, this particular appearance under microscope is called as Signet ring appearance. The ring which you wear. Okay. So that appearance can be seen for the adipocyte cells. Okay. So these are the different types of cells. Next, two types of cells are there: permanent cells and free cells. So permanent cells already we have discussed, or fixed cells. Now these are the free cells, are also called as wandering cells. तो उसमें क्या रहता है? Mainly different types of WBCs. Okay. So here you can see the list of WBCs. Now this particular thing you will be studying in detail in physiology. Okay. These things particularly you will be studying in physiology. So right now I am not going through this, though you will be studying this in physiology. So that is all about the cells. Next are the fibers. See, I am going a bit faster. Why? Because these things are already done. It's a revision. Fibers are there, three different types of fibers: collagen fibers, elastic fibers, and reticular fiber. Now, what exactly you have to know about the fibers? What exactly you have to know about the fibers? First of all, you have to know the physical properties of the fiber. Okay, physical property का मतलब दिखता कैसा है? Okay, what is the shape? What is the appearance? And along with that, if you can memorize things, then you can mention the dimension. But ये इतना याद नहीं रहता है. Okay, the dimension of the fiber. If you can memorize during the time of exam, suppose याद है, then you can mention, no problem. अगर याद नहीं भी होता है, then it's okay, not a big deal. But actually, at least physical properties are very important. ठीक है? Next, always keep that in mind. ये जो fibers होता है, उसमें कोई cells नहीं रहता है. ठीक है? तो उसका जो staining characteristics है, staining properties है, that is totally different. So directly with the help of HNE stain, we cannot stain it properly. If we stain it, the physical properties cannot be seen. That's why special stains are used. Next, with the help of compound microscope, you cannot see all the physical properties of these fibers. For that, what do we need? अगर compound microscope में दिखाई, yes, तो we need electron microscope. Common sense. Compound microscope में दिखाई नहीं दे रहा है तो क्या करना है? इलेक्ट्रॉन माइक्रोस्कोप में देखना है. ठीक है? तो व्हेन वी यूज इलेक्ट्रॉन माइक्रोस्कोप वी कैन सी द फाइबर्स प्रॉपर्ली. ओके, तो इन योर बुक यू विल सी दैट फॉर ईच एंड एवरी टाइप ऑफ फाइबर्स इट इज मेंशन दैट ईएम स्ट्रक्चर और अल्ट्रा स्ट्रक्चर. ठीक है? इसका मतलब है इलेक्ट्रॉन माइक्रोस्कोप के अंदर दे हैव सीन एंड देन द डिस्क्रिप्शन और एक्सप्लेनेशन इज गिवन. फॉर एग्जांपल, here you can see this is a electron microscope image of collagen fibers. So under electron microscope the appearance is like this. So we'll start with the physical property. So in the physical property, first of all please keep that in mind, जो collagen fibers होता है always they are present in bundles. Okay, मतलब the individual fibers together they will be forming a bundle. Okay, so always you can see the collagen fibers in a bundle. Next, the bundles of the collagen fibers, okay, they can branch or anastomose with each other, but the individual fiber remains always parallel to each other. Suppose एक bundle है, दूसरा bundle है. Okay, the bundles can be like this. Okay, but the individual fibers always parallel to each other inside the bundle. Next, if we take a particular fiber, then depending on the force applied on it, I'm talking about the bundle, it may be straight or it may be wavy. जो fibers होता है inside the bundle, how much force is applied on that, depending on that whether it will be straight or it will be wavy. Okay. Next, if you see the dimension, so under electron microscope you can see the dimension. So mostly the diameter remains 1 to 12 micrometer. 1 to 12 micrometer होता है dimension, diameter of the fiber. Now, those collagen fibers are made up of what? Suppose one bundle is there. Inside that bundle you have taken one fiber, and you are examining one particular fiber. Okay. Now, that particular fiber is made up of what? It is made up of fibril. जो individual fiber होता है, that is made up of fibrils. Okay. Now, so many fibrils will together will make one particular fiber. Now, those fibrils are having diameter of 20 to 200 nanometer, more smaller. Okay. Now, each fibril is made up of again microfibrils having 3.5 nanometer in diameter. So, first bundle, inside the bundle, one particular fiber is made up of fibril. Again, fibril is made up of microfibril. Okay, so as you come like this, the diameter reduces. Okay. Next, if you see those microfibrils, they are nothing but the chains of tropocollagen. They are made up of chains of tropocollagen, which is nothing but a protein. Okay, it is a protein, and these chains of tropocollagen, they are arranged as they are overlapping with each other. Okay, suppose one chain, another tropocollagen. One tropocollagen, another tropocollagen. Like this, a chain is formed. Okay, where alternately they are overlapping each other. Due to that overlapping fashion or overlapping structure, striations can be seen in a particular fiber. Okay, striations can be seen. So these are some important, you can say, physical properties of the collagen fibers. Okay. Next, approximately 29 types of collagen fibers are there. Okay. जो collagen fibers है, approximately there are 29 types of collagen fibers. Among them, 4 or 5 types are being studied properly, thoroughly. Okay. And in your books you can see those 4 or 5 types. Beyond that, still researches are going on. Okay. And this is the most abundant types of fibers present in our body. Collagen fibers. If you take the example of now where they are situated, if you take the example of ligament, take the example of tendon, these are the areas where these collagen fibers are present. Next, in case of bone, in case of cartilage, collagen fibers are present. Different types, but collagen fibers are present. Okay. So that is all about the collagen fibers. Here you can see how the collagen fiber look like under H&E stain. Okay. So this is a tissue of ligament where both LS and TS are taken. So in the LS and TS you can see how these collagen fibers are situated. So as I have mentioned, collagen fibers always they are in bundles. You can see in the LS these are the bundles of collagen fibers. Okay, and in between the bundles you can see some cells, fibroblast cells are present. So it is a part of ligament, that's why cells can also be seen. Next is the reticular fibers. Elastic fibers. Now elastic fibers, same like the collagen fiber, you have to know the physical properties. तो इसमें physical properties क्या होता है elastic fibers में? Yes. So first of all, the amount of elastic fibers are less. Okay, they are thin as compared to the collagen fiber. Thickness is less. Numbers are also less, and they doesn't run in bundle. They run single. Okay. Now those single fibers branches and mesenchymes with each other. These are the physical properties. Next, suppose so bundle नहीं है तो you can take one elastic fibers. So suppose you have taken one elastic fiber and you produce an image under electron microscope. तब क्या दिखाई देगा? What exactly you can see? So first of all, you can see a central core, central amorphous core, which is made up of a protein, and that is called as elastin. You have a central amorphous core, which is made up of a protein that is called elastin, and around the core you can see a glycoprotein. Okay, that is called as fibrillin. These are made up of filaments, and those filaments are nothing but a glycoprotein, and that glycoprotein is called fibrillin 1. Okay, that can be seen under electron microscope. Okay, now the periodic striations which were present in case of collagen fibers, here those periodic striations are absent because those tropocollagen, those things are absent over here. Okay, now what will be the example? Examples will be large arteries, the walls of the large arteries, in their elastic fibers are present. Then ligamentum flava, which is present in vertebral column. Okay, there also you will be getting the elastic fibers. These are some examples. Okay. Next, this is also a schematic diagram. Electron microscope structure schematic diagram. Here also you can see amorphous core, which is made up of elastin. Now elastin जो होता है वह प्रोटीन होता है. In that two different types of amino acids are present. Okay, desmosine and isodesmosine. These are the amino acids present over there. Reticular fibers. Now, what do you know about reticular fibers? Okay. Anything else about the reticular fibers? You don't get time to study books in your room. You don't get time to study books in your room. Now, I am explaining connective tissue. So during class, you shouldn't open your book. These are the things you must know. If someone is explaining something, you are studying book, what does it mean? Then go out and study. These are the small things you must learn. ठीक है? और ये common sense है. You are getting enough time to study. Go to library and study. No one will stop you. But don't do inside the classroom. Not in my classroom. In any other classroom. Don't open book. Though it is for the first time, that's why I am not reading anything. Please be careful. Now, in collagen fibers, I have told you that how many types of collagen fibers are there? Approximately 29 types of collagen fibers are there. So, type 3 collagen fibers are nothing but the reticular fibers. Okay, type 3 collagen fibers are nothing but the reticular fibers. First point. Second point, they are very thin. Okay, very thin. It is more thin as compared to the elastic fibers. Next, they are not present in bundle. They run singly. Next, they also branch and anastomose with each other. But the speciality is whenever they are branching and anastomosing with each other, they are forming a network-like structure. These reticular fibers. Okay, so उसका जो branching pattern है, वो इतना unique होता है that they form a network-like structure. Okay. Next, these striations can be seen, though it is a type of collagen fibers. Now, mostly these reticular fibers are present in organs where they are making the framework of those organs. Best examples are lymphoid organs. In most of the lymphoid organs, the framework is made up of reticular fibers. Next, in case of liver, in case of kidney, we are getting the reticular fibers. Okay, so the supporting framework of different organs are made up of these reticular fibers. This is the important function of reticular fibers. Example already given: lymphoid organs, liver, kidney, etc. Okay. Next, so whatever we have discussed, this is the gist. So what you can do while writing about fibers in your histo notebook to save time, instead of writing all those things whatever I have explained, you can just write the chart, only this chart. So in one page you can complete the fibers. Just you will draw the diagrams later on. Now one thing you have to add over here, what you have to add, to here everything is mentioned, just the examples or the location is not written. Okay, यहाँ पे location mention नहीं है. So first you write this one, then write over here location, and whatever I have explained from there, you have to mention the locations. Oh, okay, so it is there. Yes, sorry, it is there. Then you can write it directly. So you can see location is there, codes is there. Codes means the fibers, how it appears. Then striations, whether it is present or whether it is absent. Striations क्यों रहता है, that I have explained. ठीक है. Next, physical properties are also mentioned over here. Then special staining method, as I mentioned, special stains are required in order to see those particular fibers. That is also mentioned. And then other names given to the fibers. Next is the ground substance. Okay, so the ground substance, let me go to the structure. Yes, now in the ground substance, what is the composition? Glycosaminoglycan, proteoglycan and glycoproteins. These are the composition of the ground substance. Now each and every composition, what are the different chemicals present and what are the function, that is mentioned over here. Same in a similar way you have to write. Okay, so in case of glycosaminoglycan, keratin sulfate, dermatan sulfate, okay, these are the glycosaminoglycan. Right now there will be difficulty in understanding what is glycosaminoglycan, glycoprotein. Once it is started in biochemistry, there will be no difficulty in understanding this. Okay, and those things will be studied, will be explained in biochemistry. So the glycosaminoglycans which is there, that is giving the physical property to the ground substance. Next, proteoglycans, the core protein. So what it does, attachment of the glycosaminoglycan. Okay, so the attachment of the glycosaminoglycans are in such a way that it forms the bottle crust structure. Okay, and glycoproteins, fibronectin and laminin, these are the glycoproteins, stabilizes and it helps in placing the cells in the ground substance. That is the function of glycoproteins. Okay, now all those components are produced or secreted by fibroblast. Okay, the fibroblast which I mentioned earlier. That's why fibroblast cells are very important for connective tissue. Okay. Lastly, the functions of connective tissue. So the connective tissue which is there, what it will do, from the definition we have seen, it will enclose an organ, it will separate an organ, it will connect different structures, it will support, helps in movement, it helps in storage, okay, cushioning effect, transportation, protection, etc. These are the different functions of the connective tissue. Okay. So up to that much that we have discussed, and I have done the revision again. Now, next part is the classification of connective tissue. Okay. Now, can you tell me, based on what the classification is done? Two types of classification, two types of connective tissues are there. One is connective tissue proper, or also called as generalized connective tissue. Okay. And another one is specialized connective tissue. So in some book it is written as connective tissue proper or generalized connective tissue, or also called as general connective tissue. Dono same meaning. And another one is specialized connective tissue. Now, what do you think, based on what the classification is done? No. Based on the ground substance, based on the modification of the ground substance, this classification is done. Okay. Now, so modification क्या हुआ है? What type of modification is present? Now, I'll give an example. Suppose in case of connective tissue proper, you can see loose areolar connective tissue, dense regular connective tissue is there. Suppose if you take dense regular connective tissue, for example, ligament is there, tendon is there, okay, and in specialized connective tissue bone is there. दोनों connective tissue है, लेकिन क्या difference है? Bone is solid, it is very hard, and these are soft tissue. तो difference कहाँ पे हुआ है? No, cells तो दोनों में है. Difference is in the ground substance. Bone का जो ground substance है, in that calcium salts are deposited. Calcium salt cell के अंदर deposit नहीं हो सकता. ठीक है, तो those calcium salts are deposited in the ground substance. That is the speciality of bone. In case of cartilage, what is the speciality? जो ground, yes. हाँ, तो for that a specialized substance is there. That is called hyaluronic or hyaluronic acid. That is having the affinity to hold water molecule. Okay, that's why it is firm and consistent. The cartilage. Okay. So like this the modification is done in the ground substance, and based on that the classification is done. Okay. Now in specialized connective tissue, I hope all the structures are over. Blood will not discuss blood will be discussed in physiology. ठीक है, तो bone is over. ठीक है, revision भी हुआ है bone का. Cartilage is also done. Okay. Now in cartilage, one thing which is left, that is the microscopic structure. Mostly it is explained, but I have not shown you under microscope. Okay. So most probably next week or next to next week in histo class, cartilage chapter will be taken again. Okay. So in that whatever we have discussed again, those things will be repeated, and then important microscopic identifying features will be discussed. ठीक है, इसका मतलब है suppose hyaline cartilage का slide है, you have put the microscope slide under microscope. When you see the slide, how you will identify that yes, this is hyaline cartilage, this is elastic cartilage. ठीक है, तो उसके लिए important identifying features रहते हैं. So those are not discussed. Those will be discussed that time. Okay. So mostly we will be discussing about the generalized connective tissue. Now in generalized connective tissue, as you can see the list: loose connective tissue, dense, regular, dense, irregular. Okay. Now please keep it in mind. As I have seen in most of the book, it is written as regular connective tissue. Okay. And then the classification is done: dense, regular, and dense, irregular. So you can write both the things together, or you can segregate it. Next, elastic, adipose, reticular, and embryonic connective tissue. In embryonic connective tissue, I am having a slide of umbilical cord. Okay, जो embryonic tissue है, तो in order to show the embryonic tissue, generally we use the slide of placenta or umbilical cord. ठीक है, so I am having the slide of umbilical cord. So in umbilical cord, I will show you how the embryonic tissue look like. Okay, properties are quite different as compared to the other connective tissue which is present in our body. So I'll start with the loose areolar connective tissue. Now this loose areolar connective tissue, or also called as loose connective tissue, if you see this connective tissue, it is having the sampling, or you can say the components, all the components of the connective tissue. इसका मतलब क्या है? Suppose you want to see an ideal connective tissue and a structure of an ideal connective tissue, then you can choose this example. I'll tell you one thing. जैसे if you want to see the epithelial tissue for the first time, suppose a person doesn't know anything about the epithelial tissue, he or she wants to see the epithelial tissue from any book. So you have to take example, then you have to see. जैसे मान लो, you have to take the example of squamous, you have to take the example of cuboidal, columnar, epithelium to see the epithelial tissue, right? So a ideal epithelial tissue must be there. तो in case of epithelial tissue like this, ideal कुछ नहीं है. Generally cuboidal और columnar use होता है to mention the epithelial tissue for the first time. Okay. Now here in case of connective tissue, to make anyone understand about the connective tissue, the best example is this one, loose connective tissue or loose areolar connective tissue. उसमें सब components रहते हैं. Okay. Along with that, sub components means if you see the list of cells, if you see the list of fibers, ground substance, whatever we have discussed, almost in a definite proportion, similar proportion, those components are present. Okay, that's why it is called as an ideal connective tissue. Okay. So first of all, it is having loosely open connective tissue. All types of fibers, as you can see, all types of fibers can be seen in this type of connective tissue. Then numerous types of cells are present, for example fibroblasts, macrophages, plasma cell, white blood cells, all those things can be seen. Okay, fibers and cells are embedded in a gel like viscous ground substance. Okay, gel like viscous ground substance are present. Now one problem is जो ground substance होता है, okay, under microscope ठीक से दिखाई नहीं देता है. Why? Because while tissue processing it is washable. Okay, that's why it cannot be seen. So these are the properties of loose connective tissue. Now where it is situated, loose connective tissue are situated around the blood vessel. If you take any blood vessel in our body, around the blood vessel this loose connective tissue is situated. Next, around the most of the organs this loose connective tissue is present. Okay, so actually इसका function क्या है? To keep the organs or keep the structure in its position. Okay. Now tissue is found, as I said, almost in between the all organs. तो इसका जो function है mainly cushioning effect का होता है. Okay. Along with that, protection is also there. Here you can see the diagram of the loose connective tissue. So first of all, it provides support, provides plane for movement. For example, skin is moving over the superficial fascia and provides expansion of the viscera as well as blood vessel. Whenever the blood is flowing, sometimes the blood vessel can dilate. So that dilatation, the space is provided by this particular connective tissue. And here you can see the diagram of the loose areolar connective tissue, where all the fibers can be seen. You can see different types of cells. Okay. Ground substance is also there, but mostly it is washed away. इसलिए empty दिखाई दे रहा है. Okay. Now there is a important point in histology. You will observe that in some cases empty spaces are there. ठीक है. For example, here also you can see empty spaces. In case of epithelial tissue, I have told you where the mucus cells are present. Okay, there also empty spaces are there. So always keep that in mind. If someone is asking why empty space is there, so your answer will be it is washed away during the tissue processing. सबका आंसर यही होता है. क्यों white appearance और क्यों empty है? So during tissue processing, this particular part is washed away. तो washed away चला गया तो इसलिए empty. Okay. Next, what is the next tissue? Adipose connective tissue. So this tissue you have to see under microscope today. Adipose connective tissue. So what is the role of adipose connective tissue? To store fat. Okay. Now there are two types of cells. Now two things are there: adipose tissue and adipocytes. तो इसका मतलब क्या है? The cells which are present in the tissue, those are called as adipocytes. And together all the cells they form the adipose tissue. As simple as that. Now the adipocytes which are present, two types of adipocytes are there. Okay, as you can see, unilocular and multilocular adipocytes. Next, जो adipose tissue होता है, again they are of two types: yellow or white adipose tissue and brown adipose tissue. Brown adipose tissue mainly newborn babies में मिलता है. Okay, in newborn babies this brown adipose tissue is present. And brown adipose tissue का function है thermogenesis, to produce heat. That is the main function of the brown adipose tissue. Okay. Now As I mentioned, two different types of adipocytes are there. Okay, that is unilocular and multilocular adipocytes. Now, unilocular adipocytes, most abundant type of adipocytes. These are largest signet ring appearance होता है. Okay, due to presence of large fat droplet, it is pushed towards the periphery. So normal appearance already we have seen. That is the unilocular. Next, another type is there that is called as multilocular. Multilocular adipose tissue mostly they are smaller. Amount of fat droplet is also less, and the nucleus is eccentric in position, away from the center but not towards the periphery. Okay, and in cytoplasm fat droplets are present, but it is very less. Location, as I have mentioned, it is present in newborn. Okay. Now here you can see the classification in the diagram. First, concentrate over here. So the adipose tissue, two types are there: yellow adipose tissue and brown adipose tissue. Okay. Now in case of yellow adipose tissue, the cells which are both the cases adipocytes are present, but the variety is different. Here we are getting unilocular. Here we are getting multilocular. Okay. So what is unilocular, multilocular? Already I have explained. Now here, in the location you can see superficial fascia, yellow bone marrow surrounding the viscera. These are the areas where yellow adipose tissue are present, which is abundant, means बहुत ज़्यादा रहता है in our body. Okay, as compared to the brown. Next function क्या होता है? Insulation and protection. If you see the brown adipose tissue, here adipocytes are present, but which variety? Multilocular. Okay. Now, what is the location? Newborn, in the back scapular region, in the adults, etc. Okay. Now, here what is the function? Thermogenesis. That means production of heat. Okay. Now, my question is, which type of adipose tissue is this? Already I have explained you both the types of adipose tissue. I have shown you the cells also, adipocytes, unilocular, multilocular. Now my question is, which type of adipose tissue is this, and which type of cells are this? Which variety? This is nothing but the yellow adipose tissue, and these are unilocular adipocytes. ठीक है? देखो comparison दिया हुआ है. You can see the comparison. Now in case, so same thing today you have to see under microscope and you have to identify. Okay, so see the image carefully. तो इसमें क्या दिखाई दे रहा है? हाँ, तो you can see, ये देखो, suppose if you consider this as a cell, see the position of the nucleus. If you consider this as a cell, see the position of the nucleus. Okay, here also you can see the position of the nucleus. So fat droplet, large fat droplet is present inside the cell. Cellular organelles are pushed towards the periphery. Okay, now here fat droplet is present, but now why it is empty? Just now I mentioned, because during processing it is washed away. That's why it is looking empty. Okay. So this you have to see and you have to identify under microscope today. Okay. Next is the dense connective tissue. Now, in case of dense connective tissue, mainly large amount of fibers are present and less amount of ground substance is there. Okay, and the cells are also less, and cells are mainly arranged in the form of rows. Okay. Now, depending on the arrangement of the fibers, this dense connective tissue are divided into two categories. What are they? Dense regular and dense irregular. Regular में जो fibers है regular arrangement होता है, irregular में irregular arrangement होता है. Very simple. Okay. Now, dense regular connective tissue, it consists predominantly densely packed bundles of collagen fibers. Okay. Now, if you see the densely packed collagen fibers, Because of this huge amount of densely packed collagen fibers, the ground substance is very less, and in between the collagen, bundles of collagen fibers, the cells can be seen, the fibroblasts can be seen. That also in the form of rows. Okay, now where they are present? They are present in case of tendons, in case of ligaments. What is the function? To provide tensile strength to that structure. Now, in case of dense irregular connective tissue, the fibers, collagen fibers are interwoven to provide tensile strength, but it is irregularly arranged. What is the example? Skin, periosteum. Okay, these are the areas where it is present. Now, what is the function? Provide strength and protection to the underlying tissue. That is the function of the dense irregular connective tissue. So, in case of dense, regular, and irregular both, what you have to do? You have to mention the property and then you have to mention the example also. Here you can see the diagram. So, which one is regular and which one is irregular? Yes, this one is regular. Why? Because see, here you can see the regular arrangement of the fibers, bundles of fibers. और ये जो डॉट डॉट दिखाई दे रहा है, these are nothing but the fibroblasts. Okay. Now here you can see irregular arrangement of the collagen fibers. Okay. So this is the dermis of the skin. So this is the difference between dense regular and dense irregular connective tissue. What is next? Reticular connective tissue. Okay, तो इसमें क्या रहता है? Reticular fibers along with the reticular cells are present. Okay, so regarding reticular fibers already we have discussed. These are nothing but they forms the framework of different lymphoid organs. Then in case of kidney, in case of liver. Okay, what is the function? It binds together the smooth muscle tissue. And in case of lymphoid organ, it acts as a filter to remove the microbes. So these are some important functions of the reticular connective tissue. Next, elastic connective tissue. तो इसमें क्या होता है? Freely branching elastic fibers are present. Okay, yellowish in color. Location wall of the large arteries, trachea. Okay, bronchial tubules. What is the function? Allow stretching of various organs because of the presence of elastic fibers. Okay. Now, lastly, this is the embryonic connective tissue. Okay. Now, in case of embryonic connective tissue, it is mainly derived from mesoderm. So, we will be studying about the embryology from next week. So, mesoderm is there. तो जितना भी एम्ब्रियोनिक कनेक्टिव टिश्यू है, the origin is mesodermal in nature. Okay. Now two types of embryonic connective tissue are there. One is mesenchyme, another one is mucus connective tissue. Mesenchyme is nothing but the mesenchymal stem cells, which I have mentioned during the time of bone development. Okay. I hope you remember about the development of bone, endochondral ossification, membranous ossification. And that time I mentioned about the mesenchymal condensation. Okay, please start studying all those things. Now this found in embryo consists mesenchymal cells. If you see the mesenchymal cells, these are small spindle shaped, having fine cytoplasmic processes, and those cytoplasmic processes are attached to each other by gap junction. Okay. Now here you can see the mesenchyme. Okay, the spindle shape and mesenchymal cells can be seen. These are the cell processes. So these things I will show you today under microscope. Okay, similar appearance can be seen under microscope. Okay, low power microscope 10x, and then in high power under 40-45x. Okay, this kind of appearance can be seen easily. That I will show you today. So in mesenchymal tissue, you can see the mesenchymal cells. Okay, these are the mesenchymal cells. These are the processes of the mesenchymal cells, and then you can see the collagen fibers also. Okay. Next thing is the mucus connective tissue. तो mucus connective tissue कहाँ पे रहता है? Inside the umbilical cord. It surrounds and supports the structures present in the umbilical cord. तो umbilical cord में क्या रहता है? Mainly two umbilical arteries are present and one umbilical vein is present. Okay, and around that a gel-like component is present, that is called as Wharton's jelly. Okay. तो म्यूकस कनेक्टिव टिश्यू में दो कंपोनेंट होता है, एज यू कैन सी सेल्स एंड वार्टन्स जेली. तो सेल्स ऑफ द म्यूकस कनेक्टिव टिश्यू, ओके, सिमिलर स्पिंडल शेपेड रहता है, साइटोप्लाज्मिक प्रोसेसेस आर देयर. Okay, and here you can see the diagram. Okay, same thing you have to see today. Same thing you have to see today under microscope. This is the slide of umbilical cord. Okay, where you can see two umbilical arteries are there and one umbilical vein. So you don't have to identify, or you don't have to differentiate between the arteries and veins. Okay, this is not yet taught. Later on we'll study about that. Now what you have to see is you have to see, for example, the Wharton's jelly, this particular part. Okay, so cells are embedded in gelatin like round substance, it is called as Wharton's jelly. Okay, now in Wharton's jelly hyaluronic acid is there. Okay, now mostly Wharton's jelly is removed during the time of some tissue processing. Now once it is removed, the mesenchymal cells can be seen very easily. तो यहाँ पे जो ये डॉट डॉट दिखाई दे रहा है, these are nothing but the mesenchymal cells. So when we will focus under high power, okay, at that time those mesenchymal cells can be seen easily. Okay, spindle shaped appearance होगा, then cytoplasmic processes रहेगा, those things can be seen. Okay, another important point related to the mesenchymal cells. Okay, the cells isolated from the mucous connective tissue, especially from the Wharton's jelly of umbilical cord, work as mesenchymal stem cells. Now these can be used for stem cell therapy. जो stem cell therapy होता है उसमें ये जो Wharton's jelly से जो cells collect किया जाता है, from that it is used in stem cell therapy. Okay, this is low magnification image, this is high magnification image. So under high magnification, when you will see the umbilical cord, ऐसे दिखाई देगा. तो here you can see these are the cell processes. Then you can see the spindle shaped mesenchymal cells. Okay, and few collagen fibers can also be seen. Okay, so that is all about the classification of connective tissue. So which classification we have discussed today? Which classification we have discussed? Generalized connective tissue. Okay, specialized already done, that is bone and cartilage already done. Okay, so today we will discuss the generalized connective tissue. Okay, so now what we have to do, we have to see the slides. So I am having few slides, I will bring those slides. So we have to focus and then we will discuss the properties. How does it appear? Because during the time of exam, as I said, those things will be kept and you have to identify it. Okay. In practical exam, the histo slides, okay, total 5 slides are kept under the microscope. Okay, focusing will be done. What you have to do, you have to come one by one, you have to see the microscope, you have to identify, you have to write the identifying features. That also in 1 minute. Okay, in 1 minute. So just imagine how many slides you have to study. This is the beginning. For each and every organ, each and every tissue, slides are there. Okay, so you have to be very expert. And this is the basic, as I mentioned earlier. If this thing is not clear, you will be having difficulty in pathology in next year. Okay,